Hello everyone. Today we'll start covering Viva, Gulf Viva exam, or it's called an interview after the theory. That's a prometric exams. Usually in majority of the parts, many parts of the Gulf, they conduct either an interview or a Viva. So certain topics that could be asked as questions during your interview or Viva, we'll start covering. So first we'll start covering medical conditions in dental, management of certain medical conditions in clinic, infection control, following more topics. So today we will be covering rheumatic fever. Now rheumatic fever is a disease which sometimes follows a sore throat caused by certain strains of beta hemolytic streptococci. So if someone asks you what's a rheumatic fever, you can say it's a disease which sometimes follows sore throat caused by certain strains of beta hemolytic streptococci. It's a fever, but it's very rare disease, but mostly seen in western world, but is common in which countries? Indian subcontinent, the Middle East, and some of the Caribbean islands. Now clinical features of the rheumatic fever is that sore throat, say after about 3 weeks, that's about or 2 to 26 weeks, by an acute febrile illness with pain flitting from one joint to another. Migratory arthralgia, usually there is resolution within 6 to 12 weeks without apparent after effects. Pain is a pain in the large joints, which gives rheumatic fever its name, is conspicuous but heals without permanent damage about 3. So certain points that are not mentioned here, I would like to explain it to explain it is that rheumatic fever may occasionally be followed by chronic rheumatic carditis with permanent cardiac valvular damage. Okay, so the inflammatory reaction of rheumatic carditis, that's that which affects your heart, okay, appears to result from immunological cross reactivity with streptococcal antigens and immunological mediated tissue damage, which may lead after the lapse of years to fibrosis and distortion of the cardiac valves. Rheumatic heart disease. So just a fact to remember that rheumatic fever may occasionally be followed by chronic rheumatic carditis with permanent cardiac valvular damage. And something else in the clinical features we could remember about serious cardiac complication is subendocardial inflammation, particularly along the lines of closure of the mitral and aortic valve cusps, resulting in the formation of minute fibrinous vegetations and later scarring. There is usually little detectable effect on cardiac function in the acute phase, but in usually severe case, myocarditis can cause death from cardiac failure. Okay. The essential features of the chronic rheumatic heart disease are fibrotic stiffening and distortion of the heart valves, often causing mitral stenosis. This is essentially a mechanical hemodynamic disorder in which the defective valves may get affected at any time, leading to infective endocarditis. Cardiac failure can develop after many years. So this is just a roughly an idea about other clinical manifestations of a severe rheumatic fever, that is, it could lead to chronic rheumatic carditis. Now general management of streptococcal sore throat is an indication for treatment with antibiotics, usually penicillin. Treatment consists of penicillin, of the use of salicylates and penicillin if streptococcal infection is still active. Okay. So the clinical manifestation of acute rheumatic fever are so variable that the diagnosis should not be made unless at least 2 of the major criteria are fulfilled. Preceding streptococcal infection is confirmed by a high or rising titer of anti-streptolysin or antibodies, that is ASOT. Okay. However, a low ASOT, that is anti-streptolysin O bodies, virtually excludes the diagnosis. So that is our basic understanding of general management. And when it comes to dental aspects of rheumatic fever, this is the highlight of your Viva question. Mostly they will be asking you question regarding this rheumatic fever. What is your management in a dental setup? So you can say acute rheumatic fever patients are exceedingly unlikely to be seen during an attack, but emergency dental treatment may be necessary. No special precautions should be necessary, as there appears to be little risk of infective endocarditis at this stage. Now, treatment can be done. So, if you have said treatment can be done under local anesthesia in consultation with physician. Now, local anesthesia is generally safe. Now, conscious sedation with nitrous oxide may be given if the cardiac function is good and with the approval of the physician. General anesthesia should be avoided, but if essential, must be given in hospital. So, these topics are covered by referring Crispian, Scully and Roderick a Cawson book. So, kindly follow for more topics for Viva exams, Gulf Viva exams. Thank you.